Hi everyone, welcome back to another video. So sorry guys if I haven't uploaded in a while. I've been kind of busy with work. I also participated to a kids summer camp, which was awesome, which I might do a video in another time when I'm gonna just summarize this great experience as a volunteer. But today I wanted to, because some people ask for it, and I don't know if you guys know, but I'm a physical therapist, and I have a degree in physical therapy, and I work as a physical therapist, and that's much of the reason why lately I haven't been uploading anything, because like I've been working until like late evening, and so I didn't really have that much free time to record, to prepare, to record videos. But hopefully, now that it's the summer period, at least here in Italy, I might have a little bit more free time. So today I wanted to bring to you a topic which is shoulder pain with pull-ups, but it's not actually a shoulder pain. It's more like a back pain with pull-ups, which is something that I've suffered from and I'm still recovering. And so I wanted to share with you the tips or the things that I have encountered that actually have helped me. Because being a physical therapist, I also like calisthenics, I also like workouts, and I also like to train. And so it was very odd that I had this issue doing the vertical motion of pull-ups, which is this one right here, right? When you just go straight up and down. And I had a pain in this part of the shoulder, like on the back, because it's not even the shoulder, like it's here in the back. And it was right from the first pulling motion until the very, very end. It was just constant. And at the beginning, it was a little bit lower, so I still trained over it, but then over time it got worse. And of course, that means that there is something wrong. You should check, you should do something different. And I just wanted to talk about it because of the fact that if you just search for pain with pull-ups, you're gonna mostly commonly find elbow issues, shoulder issues like impingement, like rotator cuff inactivation, like scapula no working properly. You're gonna find all these things, but you're not gonna find this specific pain, at least that I had, and I've known that some other people, some other athletes have also suffered from it, which is so specific that, for example, when you do a pull-up, a vertical one, you had the pain. When you do inclined pull-up, so you just change a little bit the mechanics or the motion, and you have zero pain. And like it was also for me, I had zero pain. And I was even doing, with the elastic band pull-ups, I was doing reducing the weight in the sense, but I still had pain. And so talking with some other colleagues, and they told me, yeah, this is something that we don't really know why happens. Sometimes it's just a muscle overtraining. So maybe, you overtrained, the muscle kind of gets a little bit injured, but it's very, very small. But then you keep training over it, so it gets worse, worse, worse over time. So in order to get back, you need to reduce the load a lot, and then you need to keep increasing it without pain. So that's the issue. And now this is an image of anatomy. I always like to talk about these things because I find them fascinating, and I hope that this video can help in case some of you guys might have this similar issue. So my pain, as I said before, was around this area. I don't know exactly when, and it's very hard to pinpoint, the exact point. And I was having this pain not by hanging, not by activating the scapulus. I was only having this pain when I was initiating, so when I was flexing my elbow and was initiating the pull-up. That's when I really felt this pain. That, again, remember, it wasn't like stopping me. Like I could have pushed through it and I could have done, I don't know, 50, 60, I don't know how many pull-ups, but it wasn't like stopping me. But it was a sense of discomfort and your body telling you, things are odd, you should check. And now, what I'm going to try to show you here, this is another image of the anatomy of the shoulder from the front. It's using these very nice studies where you have right here quotations, the biomechanics of the shoulder with the scapulas, which muscles are activated, which are not, and you have right here these images. So this is the very, very beginning of the motion, right? So you're just hanging and you're initiating the motion. And as you can see here from the research that has been done on the muscles, you can see that at the beginning, the brachialis is gonna activate. So this is a muscle in the arm beneath the tricep. You can even see it right here. That helps flex the elbow. Then you can see that the lower trap is going to stabilize the scapulas. Very, very important, so that the scapulas don't fly outwards, but they stay activated, they stay engaged. This is important for the biomechanics of the shoulder, so in that way the other muscles can pull more freely and have better leverage. Then the lats kick in. You know, the lats is this very big muscle down here. Now the lower trap, in case you didn't know, is the bottom part of the trapezius. Now this is the muscle called trapezius. It's very, very large. And the bottom part, so this bottom part is called lower trap. This is the middle trap, and this is the upper trap. So the lower trap is normally the part of the trap which is less trained, is less strong, and therefore sometimes struggles in stabilizing the scapula and not letting it drive forward or drive to the lateral side. So it's important that these muscles get activated correctly. And but as I said before, well, let's just continue with the biomechanics here. Then the biceps can activate as you approach the middle range. So as you start getting up, so this is kind of the middle range, right? Oh, well, it's actually this one. You can see the biceps start coming in. So again, the muscles in the arm with the long head and the short head. So in helping flexing the elbow. Then at this range also, the rhomboids are going to kick in. The middle traps are going to kick in as well in helping stabilize the scapulas and bring them backwards. Then, of course, we have the activation of the teres major, which is also a muscle that extends. Because as you're doing this motion, you can see that the shoulder from a flex position, it gets into an extended position. So you start activating all the muscles that extend the shoulder, like the lats, like the teres major, and also because of the fact that you don't need to go straight up and down, but you also wanna further yourself from the bar, right? Because at the end of the motion, you wanna bring your chest to the bar. You don't wanna bring your head, but you wanna bring your chest to the bar. You're also gonna kind of be doing this motion. You're gonna be pushing yourself backwards in the sense. So you're going to be activating also muscles such as the subscapularis, if I remember correctly. Teres major and subscapularis. And then throughout the entire motion, of course, the external rotator muscles, so the infraspinatus and the teres minor, which are these muscles right here, by the way. So this teres minor, this infraspinatus, very important muscles because they external rotate the shoulder. And again, external rotating the head of the humerus is important, again, to keep the biomechanics correct of the shoulder, to reduce impingement issues, to put your shoulder in a more healthy position, and also in that way the other muscles can have better leverage. So you can see that this works, it balances it, and it works always, right? And then at the very end, interestingly, the triceps also are gonna help. Now the triceps are the extensors right here of the arm, which is odd, right? Because you're actually pulling. So generally in pulling exercises, you don't use pushing muscles. But it's interesting that at the very end, so if you wanna like touch with your chest the bar, you're doing this very small kind of extension of the shoulder, right, to reach it. So I think that's why the tricep activates, because the tricep helps in extending the shoulder. So I will argue that's the main reason. And yeah, that's it, right? So you can see the scapulas always moving backwards. Very important, the scapulas don't move upwards or to the side. Otherwise, you just lose the force that the muscles can generate and the help in going up. And again, this is another image for how it happens. And then at the very, very end, you just reach the top position, see? Some people prefer doing pull-ups in this way with this kind of bars. So in that way, they don't have to kind of push themselves back from the bar, but they can just put themselves like in a straight line, and they're not going to be hitting with the head the bar because of the fact that the bars are done in this way. See, so there is a hole. But the most important thing is that you flex as much as you can the arms, right? So your forearms are touching your biceps, and you can't go any more up. Remember not to flex, not to cross your legs. So it might be best to just keep your legs straight to engage more your core. And also to squeeze your legs a bit. And you can see at the bottom position, very important, also not sinking in. So not like activating your upper traps, trying to push your head over the bar, but always trying to pull your scapulas down, right, and back. So keep activating the lower traps, the middle traps, and not letting the shoulders drive up, but keep them down, and just go as much as you can up, and then you go down, right? So these are the biomechanics. Now, the problem for me was that I did some tests, right, because of the fact that, well, I had some pain in this part of the back. So, well, the first thing that you think about is a deficit in external rotators, right? So either teres minor or the infraspinatus not working properly. So I did some tests, and no, I have these muscles pretty strong, pretty active, that can stabilize very well, and I had no pain in doing all the different tests. Then I did some tests for the activation of the scapulas. So how about the scapulas? Am I activating properly the rhomboids, the lower traps? Am I strong enough in terms of the subscapularis, the serratus anterior? Am I doing it correct? And again, I did different tests, and it was so. I had no pain with activating these muscles. I had them pretty strong. I had them active in the correct way. So I had correct biomechanics. Or at least, I didn't have any major issues that could answer the problem, the pain that I had. And so after looking at, okay, well, biomechanically, you have all the muscles that are strong. You don't have any apparent deficits in terms of strength, in terms of stability, in terms of mobility as well. You don't have any apparent issues. Again, the lats are pretty flexible. Yeah, I'm not a flexible guy, but like comparing one side to the other, they were pretty similar. But in one side I have pain, in my other I didn't. So again, that was weird. And again, I had just no clue. Well, what is it then? If I had all these tests are negative in the sense that I have stability, I have strength, I have mobility, I don't have any apparent deficits, then why do I have pain when I do the pull-ups, right? And well, the end of the question is that you don't know. You don't really know why these things happen. Like some colleagues have told me that what sometimes happens is an overtrain, so the muscle gets slightly strained because it maybe gets overtrained or because of other minor things, and then the fact that you keep training over it, you make this training kind of worse. So the muscle is still very strong. It doesn't have any apparent deficits when you test them, but when you put them in that position that maybe stretches them a little bit more, or when they have to engage more in a certain position, that's when you have the pain. And so the best thing to do now that I go to the treatment, so how to treat if you have this kind of pain where all the tests are negative, you don't have any apparent deficits in terms of scapulas, stability or strength, rotator cuff, other issues. Well, you just go back to the lower load. So if, for example, my issue was doing vertical pull-ups, I have pain. Well, what about sitting pull-ups with with an elastic band, right? So you're not pulling your whole body weight, you're just pulling some of it because you're using an elastic band. And I said, yeah, I still have pain. Okay, well, what about now not pulling anymore, but now you just put an elastic band and you just try to pull down the elastic band. So it's not anymore a pull-up, but it becomes a pull-down because you're sitting and you pull down something. And with reduced load, then I was at a certain point and said, yeah, I can do this. I feel no pain. Okay, perfect. So what you do then is you start from that point where you feel no pain, right? So it's still vertical pulling, but you feel no pain. And you progressively, you get back at your original weight. So for example, for me now, it's been a couple of weeks since I've started rehabilitating in this way. And I started saying, okay, 1 week using that particular elastic band. Then the next week using a harder one, saying, okay, how it goes. Do I feel pain? A little bit, but not really that much. Perfect. And you just keep training. And the training can be just pulling, holding, and slowly descending. The pulling can be just one arm. You hold and then slowly up. It can be with both. It can be different grips as well. It can be anything. Just make sure that you always control the eccentric, so you never just let it go, but you always control the eccentric. And reps around like 15 to 20 reps is fine. And you just progress through there. So now I'm at a point when I'm doing like pull downs in like a machine that we have at work. I'm doing it with not a lot of weight, but already more weight that I could handle at the beginning with almost no pain. And the important thing is always like taking care of the pain. So pain is your indication. If you do a certain motion and you feel I'm straining it too much, it's too much pain, then you don't do it. You reduce the load. If as you're doing it, you say, yeah, I can do it. I have a slight, very slight discomfort, but it's not really painful. I could keep going. Then that's when you keep going. You use that particular load. You don't want to make it too easy that you're not really engaging, you're not really strengthening the sense of your muscle. So you want to be always at the limit and using the pain threshold. And yeah, I'm just keep progressing through there. And then after that is when you can handle with a pull down a pretty significant amount of weight with no pain or with almost no pain, that you feel pretty good, you know, compared to your previous pain. That's when you try to move into the pulling bar, right? So it becomes a pull-up with now elastic bands. You put a lot of elastic bands first, again, with no pain or very little discomfort. Okay, is it okay? Then maybe you remove one elastic band, or you use a one that is slightly milder, and so forth. And then you just keep progressing through there until you eventually can go back at doing a full pull-up without having pain. And that's just how you rehab these kind of issues that are very complex, that sometimes we don't even know the reason why these injuries happen. But well, they do happen. And the best thing to do is remember, reduce the load, start from low load, and then eventually build up your strength. Always think about the pain, never going through pain, but always a little bit lower, and then building up your strength from there and allowing your muscle to once again recover or be able to perform that particular load because you have strengthened it slowly, right? The slow strength recovering is the best thing in these kind of issues. So yeah, that's it, guys. So I hope you enjoyed. Thanks for watching and see ya. Bye bye.